Hi, everyone. It's Dr. Haddad, the Chief of Staff at the hospital. Hope you're doing well. It gives me pleasure today to welcome a few of our specialists at the hospital. First one is Dr. Liebert. She's a cancer specialist. And I have Dr. Singh with me, is the Chief of OBGYN. Dr. Giffen is a geriatrician. And Dr. Al-Zubaidi is a lung specialist, a respirologist in town. The topic today is going to be to discuss the latest in vaccination in terms of both benefits and any concerns about side effects, and why would we even consider taking the vaccine for COVID-19. I'll start first with Dr. Liebert, since most of our patients have cancer and they're usually immunosuppressed on chemotherapy or radiation. And what's your take on the benefits of COVID-19 vaccination? What do you tell your patients about it, Julie?
Yeah, excellent. So most of the COVID vaccine clinical trials didn't include the cancer population in the clinical trials. There is some active studies going on now. However, it's not a live virus, and we do recommend a flu shot for all of our patients with cancer, which is kind of a similar style of vaccination. Our patients are variably immunosuppressed, and so it's really important for our patients to have a conversation with their personal medical oncologist to get advice in regards to the pros and cons. The guidelines that we have from our Cancer Care Ontario and from the American Society of Oncology do recommend it for the majority of our patients, and there's very few exceptions to that rule where we do recommend postponing it or avoiding it temporarily. There is some theory that it may not work as well in some immunosuppressed populations, but the general consensus is that the risks or the potential for side effects is very minimal in this population.
Okay, thank you. So we take it then from general cancer population to more specific lung disease. And Dr. Al-Zubaidi, what's your advice to your patients in your busy practice there? With you have many patients with lung conditions, whether it's COPD or emphysema, interstitial lung disease, lung cancer, etc.
Exactly. Thank you. Yes, I have been in contact with my patients and trying to explain how effective and good this vaccine on the long term for them. There have been many questions about having a vaccine, like a RNA vaccine, someone with COPD or structural lung disease or pulmonary fibrosis. And there's a concern that this may make their lung disease worse or may throw them into exacerbation of the underlying lung disease. There's no evidence whatsoever that this would happen. The vaccine would carry much more benefit long-term than, even more beneficial than probably the the influenza vaccine that we take every year. This is a horrible disease. It's a lung disease. It's you don't get vaccinated, you carry the risk of having much more problems down the line. I wanted to say one thing. There are some symptoms that develop after the vaccine. That's not a COPD exacerbation, like a bit of fever, a bit of acheness. You might feel like a bit of headaches, fatigue. That's true. That's not an exacerbation of lung disease. That's a common side effect. Pain where at the site of the injection. These are common reported things. So please go ahead and take your vaccine. This is going to be very, very, very helpful.
Thanks, Dr. Al-Zubaidi. My understanding is that I know we've shared some patients in the past who have COVID disease, and the ones that have survived and discharged from the hospital, I understand some of them, not all of them, some of them continue to see you with some symptoms. Is that still the case?
Oh yeah, we still have a lot of good population of long haulers. Like they have persistent symptoms of fatigue. We're now I have patients that have had the disease for 6 to 8 months since they had it. They were in the hospital. Some of them developed interstitial lung disease. Some of them developed lung symptoms like of cough and fatigue. But they are starting now to have some improvement in the fatigue and the cough and the other symptoms. But the guidelines so far still recommend vaccinating those people, but they're talking about doing only one dose for this population of patients.
Yeah, I mean, I see a lot of focus on mortality, but there's more to it than just dying from the disease. Many people recover, but some have residual symptoms that last for a few months. The next population that has a lot of questions about vaccination is the healthy young population that is planning to get pregnant or is pregnant currently or breastfeeding. So Dr. Singh, being an obstetrician, what's your advice to your either expecting moms or young moms or women who are planning to start a family?
Thank you, Mike. So, you know that when they did the research on the vaccine, this was not done on pregnant patients. So we don't have the studies on the pregnant patients. But however, this is actually recommended for all pregnant patients. Again, you have to take precautions as you would take for any other allergies that you would have for vaccines. But I would suggest that even ACOG and the SOGCR guideline basically recommends for all the pregnant patients to have it. Recently, they vaccinated in Israel, all the pregnant patients were vaccinated. So I would strongly recommend that they should talk to their physicians before getting the vaccine, but otherwise overall there is a recommendation for that.
Is there any known consequences if someone actually is pregnant, let's say 5 months or 6 months, and develops or contracts COVID-19? Is there a risk?
So even those who have contracted COVID positive, they are also recommended to have vaccines later.
But in terms of the outcomes, if someone is pregnant, even though they're usually younger and healthier, if they have that disease, it's sort of a balance between should I be vaccinated or I'll take my chances and get the disease. And what's your feeling about that?
The overall recommendation now is to take the vaccine, no matter what, because the consequences of disease itself is quite difficult for the mom, even though they didn't see any problems with the babies so far, those who were delivered.
Yeah, thanks. Well, coming up to a different segment of our population, the geriatric population, so 65 plus, it's been clearly demonstrated in all studies, and the latest data I've seen is that the risk of poor outcomes with COVID-19, especially mortality being the worst one, is quite dependent dependent on age. There's a clear step up in risk of mortality as you go beyond the sort of 65, 70, all the way up to 80 and 90. And the latest study I looked at, it looks like the odds ratio, so the odds of dying from this, is almost 3 times as much if you're in the geriatric population versus in the younger population, and that far exceeds even comorbidities like having lung disease or cancers, or age is very important. So what's your advice? Because I'm sure I know there's two populations roughly now. There's many people who are anxious to get the vaccine, and there's people who are, a bit nervous about it or have a lot of questions about it. So what's your advice, Dr. Giffen, as a geriatrician and deal with that segment of the population?
Certainly, as you summarized, age is the #1 risk factor for negative outcomes as a result of a COVID-19 infection. And even beyond mortality or hospitalization, there have been so many deficits or negative outcomes to the older population as a result of prolonged isolation and visitation restrictions because of having to control this and protect that population. And so unfortunately, the Canadian Geriatric Society and the American Geriatric Society have not released a statement in general about proposing or encouraging those to get the vaccine. But initial data, or the data that we have at least thus far, is very promising that this is efficacious in older adults and is safe in older adults, and the same in the younger population. The Pfizer trial did include older adults up to the age of 85, which is very encouraging. Many trials don't include anybody beyond 65. They also included a significant number of different comorbidities. And so with the data that we have thus far, I would absolutely encourage it in the older population, because the risk of death and hospitalization is so significant that I do feel that with the knowledge we have thus far about the benefits, it does significantly outweigh the risk. And yes, there's a lot of hesitancy and maybe even some misinformation out there about the different types of vaccines that are being released. Some provinces are in agreement with different variations of the vaccine, such as the AstraZeneca vaccine. Specifically, Alberta has not recommended it over 65, and it's because initial data felt that it wasn't as effective. There have been some very recent studies out of the UK, observational studies that show that it is just as effective as Pfizer or Moderna. And so therefore you shouldn't turn away an effective and safe vaccine if you're given the opportunity to take it. And again, it needs to be a discussion with your healthcare providers that are following you directly. But as of right now, the data is promising. Obviously, the biggest shortcoming is that we don't have long-term data. So we don't know how long protection lasts for, but hopefully with time that will come and we'll be able to make more and more recommendations.
Yeah, I see that Germany yesterday reversed their course, and now they're recommending AstraZeneca to people above 65 now.
That's correct. And I think it's
yeah.
very promising. Yeah.
Yeah, and this is fresh as of today. There's some information showing that's actually effective against the Brazilian P1 variant as well, which is very promising.
Yes, it's showing effectiveness against the different variants as well. And there's some data out of Israel as well that was showing a reduction in hospitalization in the over 60 population that had received the vaccine compared to their younger cohorts. And so even promising, not just from a mortality standpoint, but from a morbidity standpoint, and that their illness was less severe. And that's very encouraging.
Well, the good news that we're hearing today from the feds that we have way more supplies coming in, so hopefully we'll see that to fruition. And I see that our public health unit is rolling out as of next week to start the 90 plus and hopefully the 80 plus soon afterwards vaccination. So thank you so much today. I mean, my advice to our own community is that if you have any questions or concerns, just reach out to your own healthcare providers, ask questions. Don't be shy, but the general recommendation is to go ahead and get the vaccine. All the 4 approved vaccines as of today, the Johnson & Johnson, AstraZeneca, Pfizer, and Moderna, have been approved in Canada, and they're all very efficacious in terms of reducing morbidity, mortality, and hospitalization. If you have any history of allergies to vaccines, definitely discuss with your healthcare providers, or if you have any specific concerns. Otherwise, thank you so much for joining us today, and we'll see how the next 2 or 3 months go with the vaccine rollout.
Thank you.
Thank you.